This is an example of poor professional boundaries. Kia is a 25-year-old hospice aide. About 6 months ago, she began to care for a terminally ill patient, Harry, in his home. Harry's wife, Brenda, is such a trooper, and both of their children and grandchildren visit frequently. Kia admires Harry and his family. They seem like such a nice, loving group. Last month, Harry insisted on inviting Kia to a family birthday party at Harry and Brenda's home. Kia felt flattered that Harry invited her. She's feeling a little like family. Not only did Kia attend the party, but she stopped by on her day off to help Brenda prepare the meal and do a little vacuuming. Brenda asked Kia to pick up the birthday cake before the party, which Kia was happy to do. Last week, Harry took a turn for the worse, and Kia knows the end is very near. Although Kia has 5 years' experience in caring for hospice patients, she finds herself very depressed at the thought of Harry's death. She will miss Harry and his family very much. So the issues in this scenario. First one off is accepting invitations to private family functions. At that point, she should have said no. She is not part of the family, however much she feels she is, and accepting invitations to family dues is just completely unprofessional. Difficult sometimes to say no, but you have to have that ability. Simply explaining that it's not acceptable, it's not part of your job role to attend private functions, that heads that off, stops it being a problem. Second main issue is the issue between paid time and days off. As a paid care worker, you are paid to be on the premises. You are paid to do the jobs that you are paid to do. On your days off, you are not supposed to be there. This means you are not insured. If anything happens, anything goes wrong, you become liable. Your company's liability insurance is only valid for the period of time you are paid to be there. If you do need to extend that visit for some reason, because there's been an issue you have to deal with, this needs to be reported to your manager so it can be logged as extra time worked. But we do not go in to visit the people on our days off. We also need to look at the job scope. We've mentioned previously insurance, how it's invalidated if you're not paid to be there. It is also invalidated if you are doing jobs outside of your role. Now, Brenda's role as a hospice worker does not mean that she is paid to cook. It does not mean she is paid to clean. It does not mean she is paid to shop. So any of those jobs she is doing off her own bat. And that is not acceptable. We have to look at the personal attachment issue. Now, throughout this, Kia says she is starting to feel like part of the family. She is not part of the family. She is a friendly professional. She is not a professional friend. She needs to learn those boundaries. She needs to be taught those boundaries so that when she's going into that service, she is going in as a paid care worker. No matter how friendly the family are, no matter how much they involve her or try and involve her in the family, she is never part of that family. The final issue is resilience. It says towards the end of that scenario that she knows that Harry is nearing the end of his time, and she is very upset by this. She's depressed by this. She's loved being a part of that family unit, and she's going to miss not being part of it. Now here we need to be questioning her resilience. Is she at this moment in time strong enough mentally to actually work in this very demanding field? Does she need some time off the front line? Does she need some extra support from the organisation? Does the organisation have mental health first aiders in place who can actually help her to regain her strength or signpost her to somewhere where she can get that strength? But she should never be in a position where she is feeling depressed at losing a client.